Just need a vote.
Discussion, Councilmember Brown.
Thank you, Mayor. I received some correspondence from some fire department folks, and so I want to take some more time to investigate these items 8 and 8A, so I'll tag, please.
Items for discussion.
Oh, yes, ma'am.
Councilmember Adams.
Are we discussing item number 8A?
Yes, ma'am.
8A? Okay.
8 and 8A.
Okay. First, thank you, Councilmember, for releasing your tag. I really appreciate it. Both of these items, 8 and 8A, are purchases for fire trucks in District D. One of them is ladder truck at 55, and I know that they've been waiting for a very, very long time for a new ladder truck, and I just want to thank the HFD for considering this particular fire station that's on Cohen, so they can have the apparatus and the type of equipment that they need to be able to fight fires. And so I just wanted to make that comment, and that and where these funds are coming from, I really support them on that. So I just wanted the public to know about what items that are being tagged this morning, and I just wanted to chime in on that. Thank you, Councilmember, for this year's tag. Thank you, Mayor.
Item 8 has been tagged by Councilmember Brown.
And 8A, is there a motion?
Move. Second.
Discussion. Item has been tagged by Councilmember Brown.
Okay, now, item 10 is an ordinance.
Tagged by Councilmember Rodriguez.
Okay, and then 10A, is there a motion? Okay, you got that.
Tagged by Councilmember Rodriguez.
Okay, item 11 is a resolution. Need a vote.
Discussion. Favoring, opposed?
No.
Item carries. Councilmember Brown voting no.
Item 12 is an ordinance.
Discussion. Favoring, opposed?
No.
I'm sorry, Councilmember, if I'm in the middle of a vote and you want to stop it, you need to say something. Councilmember Brown.
Thank you, Mayor. This item number 12, to even think that we would have this on the agenda, very authoritarian type item here. First of all, of course, we do not have the money. We don't have a printing press at City Hall. City's broke, the city's going broke, federal government's going broke, and we want to continue throwing money, hard-earned constituents' tax dollars on frivolous stuff as this. How about showing our young people how to free themselves from the slavery of sexual promiscuity and empowering them through abstinence education? Perhaps for some that's a shocking consideration, but this nation needs to return to our foundation of biblical principles being taught in schools versus government trying to educate folks on how to plan a family when they can't even define a family. Rather sterilize our young girls. My vote's no on this.
Councilmembers, this is a family planning item. Councilmember Noriega.
Thank you, Madam Mayor. I think that there's a little unfortunate language in this item, kind of in the definition of who's eligible for the services. But this is family planning opportunities, and I'll tell you what I'm concerned about. I don't necessarily take issue with my colleagues' comments. What I am concerned about is that we're slowly but surely strangling off options for women who don't have the means to take care of their families and their own personal health. And I think having counseling, plan education, those kinds of things are awfully important. And we're having kind of a controversy at the state level about cuts that have been made. There's some question about whether this administration is going to put them back. There are issues at the federal level. I'm just worried that we're creating more and more barriers for women to manage their own lives, because part of women being able to be in the workforce, plan their families so that they are able to take care of their children, all of those things has to do with having quality health care. I think it's one of the single most important things that allow women to prosper. And so I just want to point out that I think it would be very easy to perhaps misinterpret some of the language in the RCA, but I don't think this is anything but a positive thing for women's health care. Thank you.
Councilmember Davis.
Thank you, ma'am. I just wanted to say, I concur after having gone to Amy's meeting last week. Amy's was empowering women to make decisions about their own body, about, preparing for their family, being part of the workforce, and being part of society, which we need to take seriously and understand that, they should have a say in what they, and how they conduct their lives. And so I just want to say, I agree with Councilman Noriega.
Thank you, Councilmember. And to be clear, the City of Houston does not provide any services related to the termination of a pregnancy. It's all pregnancy prevention services. Councilmember Bradford.
Good morning, and thank you, Mary. Council members. Am I right to, when I conclude that these dollars will be spent on counseling and education services exclusively? I mean, it's not like any type of services will be performed other than counseling and education services. Is that correct?
No, sir. It also provides various contraceptive methods, hormonal implants, oral contraceptives, and so forth.
Okay, but I think maybe that's what, when I read through it, I didn't get that from reading the material that had been supplied, and maybe that's failure to do due diligence on my part by not digging deeper and asking for additional information, because it was not my understanding that those type of services were included in the proposal in front of us. But nonetheless, I still think that for the city to assist with the counseling services and educational services for residents who are in the city of Houston, I think is something that should be done, in that there are some people simply need to be educated, and others don't have an opportunity to get educated because it's not being provided at home. They can't get it elsewhere, so it's definitely needed for the greater good of all. And I would say to my colleague, Councilman Brown, when you said the city is broke, you scared me, because some of us have dedicated a long time to the city. You have what we call a vested interest in it. And to the thousands of city employees out there, I don't want them to think that, my goodness, the city's broke or going broke. Though the city does spend a lot of money on things I think we should not spend it on, but we're nowhere broke today. Having said that, I'm concerned about some of the services that are provided here, but since we can't bifurcate what's in the RCA, counseling and education services are needed. For that reason, I'll defer to support. Thank you.
Councilmember Cohen.
Thank you, Mayor. I think as you read through this, I think it's fairly clear exactly what this does. And I think in light of the fact that women's health is under attack across this country, decisions that we make on our own about our bodies, the fact that Texas, I think, is the second in terms of the greatest number of unplanned pregnancies, to be able to help women understand their options, I think is incredibly important. And unless I'm having a problem reading this, it says, this contract allows for reimbursement of comprehensive family planning services, inclusive of medical counseling, client education, referral to partnering health organizations, community education, and outreach. It does also say termination services and/or products are excluded. I think that's fairly clear, and I think anything we can do to provide health services to women and to men is extraordinarily important. So I'm clearly voting for this.
Councilmember Adams.
Thank you, Mayor. So I thank my colleagues for their comments, but there's one particular issue that we also need to let the public know as well, that these are grant funds, and anything that we go after to offset what we do in the city of Houston to offset our budget, I commend our department heads for looking at ways, and Director Williams and his teams. And I want to thank because some people may think that we're misusing federal dollars. In this case, I don't think that we are. And so this is another way that we can look at ways to provide a medical service, especially to those that are underserved. Otherwise, will not seek out medical care in our communities. So I just want to thank him, and thank you, Mayor, also for your leadership and making sure that we're able to receive these particular funds in our local government so we can provide those services. And that's why these particular funds are so needed. So again, I commend the health department for what they're doing, what they're trying to do, to especially educate our women on the importance of medical care for them, to make sure we can catch things early and have preventative care and preventative measures in our communities. So kudos go to the health department. Thank you.
Thank you, Councilmember Williams, and we continue to aggressively pursue all state grants available. Councilmember Gonzalez.
Thank you, Mayor. Just want to add a few points that clinics serve over 15,000 patients per year, so there is a large demand for it. They are on sliding scale, so the city can receive some reimbursement for it. And as Councilmember Adams stated, this contract just allows the city to receive reimbursement for costs of services that we're currently already providing. So just to echo her point that we are actually receiving some federal grants to help compensate for these services that we're providing to over 15,000 new students. Thank you.
Councilmember Christie.
I'll probably vote for this item, but I just hope and pray that they also tell them when they prescribe hormonal treatment or implants and such, that they talk to them about the downside, the side effects of the prescriptions.
Thank you, Councilmember. Are there any other questions? Moving to a vote on item 12. Favoring, opposed, no. Item carries with Councilmember Wong and Councilmember Brown voting no.